Hello everyone, my name is Connie Lopez Barrera, and I will be speaking to you about the Change Health data breach which occurred in 2024. Throughout this presentation, we'll be applying different security models and identifying appropriate countermeasures that may have prevented this very breach. This breach is reported to have exposed 190 million records. The company wound up paying out 22 million in ransomware, and this of course affected the healthcare sector. It would be important to know that saying the healthcare sector sounds a bit generic, but this means literally every hospital throughout the United States. It also includes every physician office, big and small, and this breach also greatly affected individual patients. One of the key ramifications of this breach was that the inability to verify insurance eligibility meant that many patients would have procedures canceled, and it also meant that many patients who depend on life-saving medications would be unable to fill those prescriptions. Because no matter your income, if you're used to paying either $0 copay or a very low copay for a specific medication, all of a sudden overnight, CVS and Walgreens ask you to pay $800, $1,000, or $2,000, and these are very realistic fees. You may not be able to cover those costs. An overview of the breach is as follows. The world was notified on February 21st, 2024, though it actually began on February the 12th. The actors responsible for this fallout is the Black Cat ransomware group. The way that they got in is that they stole credentials via a Citrix portal, and this portal did not have any type of enhanced authentication challenge. From the time that the breach started to the time it was discovered, it was a total of 9 days. Now, this is much shorter as compared to other breaches where the perpetrators are inside an environment for months or even over a year. But the impact to nationwide claims processing was massive because that was halted literally for weeks. Actually, in our contract with Change Health at Jackson Health Systems, we actually did not allow for any integration or any communication between Change Health and Jackson Health. And actually, when we restored that was only after receiving a forensic report. And it wasn't even to the original Change Health network. It was to their now parent company, Optum, which had purchased but had not integrated with them yet. In the meantime, we did have Change Health staff come on site to Jackson Health System, and it was very costly to them because they had to work on our computers. The work was delayed a lot because they had to do a lot of offline work without their applications, which supported the business process. Now, the attack chain for this breach included the following. First, obviously, there was a credential theft which occurred via the Citrix environment. The initial access was that they were able to log into the portal, which did not have any type of enhanced authentication. Then they were able to move laterally, which means they were able to go east-west, anywhere really on the network, unimpeded. And they were able to steal data, which is the data exfiltration. It's reported that they exfiltrated a total of 6 terabytes. The type of data included both health and financial data. And at the end of their time on the network, they deployed encryption. And in my mind, I would venture a pretty solid guess that this is why it was caught 9 days later. It wasn't necessarily because they had any type of detective controls to alert them, but it was a fact that when data becomes encrypted, processes break. You can't access certain things. And so probably the first time that somebody tried to access something on these servers and they got an error, when the admins went to review the servers, they found encryption. And so, as many of you may have seen on different YouTube videos and things like that, they drop also text files that say you've been owned, you've been encrypted, things like that. And so that's probably why it was discovered 9 days later, because the group was done. When you think about the models that we learned about in this module, I found good application for the 3 models as follows. Regarding Bella Padula model, which focuses on confidentiality, and in this model, a subject cannot read up or write down. Change Health failed with this model's core principle because the attackers were able to move on the network uninhibited east-west with a single set of stolen credentials. So this means basically there's no security controls on the network to prevent you from going wherever you want. And this is a huge problem. And they were able to read highly sensitive PHI, protected health information, far above the level of those initial credentials. So the violation is that there was no clearance level enforcement and the attackers read anything. The second model that I'll cover is the Clark-Wilson model, and this model focuses on integrity and controlled access. And the way that this applies to this breach is that the model forces well-formed transactions and separation of duties. And this breach clearly shows that there was no separation between network segments, and that once inside the network, the attackers were able to access anything from claim systems billing to PHI databases. They did this without passing through any further integrity checks. So the key violation is unconstrained lateral movement. Lastly, the BIBA model focuses on integrity, and this model stipulates that there's no reading down or writing up. The purpose is to prevent integrity corruption. In the case of the Change Health breach ransom, deployment and proliferation of ransomware, meaning of tampering with the files and encrypting them, is a direct BIBA violation because the attackers wrote malicious code into a high integrity production system. So no integrity labels existed to block the ransomware from overriding the clean data. Overall, I believe the Change Health breach is a really good example of how these three different models with very specific criteria are all violated. So now, having looked at how the breach began and how the different models are violated, it is important to look at the different types of countermeasures that are available to potentially have defeated the adversaries then, or certainly prevent a breach in the future. And so there's different things that could have been done from all of these areas: preventative, corrective, detective, and deterrent. For example, from a preventative countermeasure would have included having multi-factor authentication on all access points by being able to enforce MFA. For example, at the Citrix portal level, it could have stopped an attacker in their tracks. Now, let's recognize, though, that it is true, and we need to acknowledge that if there's any unpatched vulnerabilities on the Citrix system, that perhaps those vulnerabilities could have allowed the attacker to bypass MFA. So that's always something you need to consider and avoid those vulnerabilities, of course, and remediate them. But having MFA at the portal is almost an instant, very effective solution, security control to block an attack. Secondly, on the preventative measures is having network segmentation and least privilege principles. When you segment critical systems, in this case PHI, and clinical systems that have very sensitive data with firewalls and other capabilities, it would have prevented the bad actors from reaching that sensitive data and exfiltrating it. So that's really very, very important. Now, on the detective end, it's important to have capabilities such as SIM and anomaly detection. Even though I mentioned earlier on that this attack was only 9 days versus breaches where bad actors have been in-house for months and even over a year, is still a very bad outcome, because I would expect, again, that the only reason that they found out they had been breached is because the files were encrypted, and not because really they had any other way to know that it had happened. So having behavior analytics on the network is this huge and incredible detective control. We run a behavior analytics solution as such a wonderful solution to see misbehavior almost in real time. And so coupled with SIM, it's a critical thing to have. Having immutable backups these days, especially when you want to carry cyber liability insurance, is really a key requirement anyway. But having immutable backup means that those backups cannot be tampered with or modified in any way. So if Change Health had had those immutable backups, that would have given them the realistic option to recover and not have to pay the $22 million in ransom. Also, a corrective control is to have incident response retainer and well in place before anything happens. You want to know what company you will be working with for incident response and forensic investigation well before anything happens. It's really very much too late if you're having to figure that out after something happens. Also, when it comes to third-party security audits and penalties, that's very much a deterrent control, I should say, a deterrent. And that is because most organizations may put different processes in place in order to avoid those civil penalties. The Office of Civil Rights is the group or the department that investigates after there's a breach of any incident that deals with healthcare information. And so they will levy penalties into the millions of dollars. And also, deterrent for attackers would be if they knew that companies would not pay the ransom. So in this case, if they knew that Change Health was not going to pay the $22 million, they might have avoided them altogether. Lessons learned. Here are a few but very important lessons learned. These items are some very basic low-hanging fruit in my mind and best practices, but there are improvements that not only healthcare organizations should make, but actually any business, any sector. Number one is to have MFA everywhere, to have additional challenge to authentication at different points in a process. For example, we have a system, an employee system, where people may log in to request vacations and do other things, but anytime they're going to look at their pay stub or they're going to retrieve their W-2 form, for those of you that have employment will understand what a W-2 form is, the system will prompt you for a multi-factor token. And so this is an example of authenticating at different points in a process and asking for higher fidelity of identification and authorization to ensure the process remains secure. Tying this back to the models, this supports the Bella Padula model. Secondly, the concept of assuming breach, this is very much like the zero trust model on the network. And if you're assuming breach, you're going to be providing everyone with whatever they need to do your job and nothing more. The principle of least privilege and separation of duties. And this would very much support the Clark-Wilson integrity of transaction models. Thirdly, detect ransomware before it deploys. And this is where you want to have behavior analytics. And there are a lot of great solutions to help you do this. We have had an AI solution before anyone ever used the term AI that does behavior analytics. And you also want to have your 24/7 security operations center monitoring, doing threat hunting. All of these items here in the third bucket will tie back to detective countermeasures. And the last point I'll make from the lessons learned is that you want to have resiliency. And that means a lot. This is not only that you have your immutable backups, but that testing of those backups and the procedures that go along with it is occurring. This is ensuring that staff knows how to rebuild, for instance, the Active Directory infrastructure, DNS, and any other infrastructure components that your applications depend on. Because many times people will think about backing up and restoration of the application, but are not thinking about the underlying fabric that supports it. Ultimately, everything we've discussed today about countermeasures and lessons learned speaks to a defense in depth strategy. And it's really accounting for every layer of the stack, every risk associated with each of those layers in order to help keep an organization's operations running cleanly and fighting another day the bad guys out there on the internet. Thank you all.